Hello everyone, good day! So our topic for today is about acute kidney injury or AKI. So what is acute kidney injury? It is the rapid loss of renal function due to the damage to the kidneys. Ang term na acute kidney injury has replaced the term acute renal failure. Why? Bakit nga ba? You tell me! Char. So, pro nga agad ni ginislan sang AKI ang acute renal failure because it better describes the syndrome in patients, not only simply those who require renal replacement therapies but also those patients who experience minor changes in renal function. Acute kidney injury is the rapid loss of kidney function from renal damage. It occurs abruptly and can be reversible. It could also lead to hypoperfusion, which refers to a condition where there is a reduced blood flow, oxygen, and nutrient delivery to tissues and organs. It could also lead to cell death and decompensation of renal function. The prognosis depends on the cause and the condition of the client. Near normal or normal kidney function may resume gradually. So, pwede pang unti-unting bumalik yung normal function ni kidney. O diba, may comeback sa AKI. Sa inyo, nag-move on ka na ba o umaasa ka pang babalik siya? So, we have 3 possible causes of AKI. As you noticed, meron siyang color coding. Parang color coding ng trash bin. Hayaan nyo na guys, visual learner kasi ang person and it will be easier for me to learn kapag colorful yung handouts. Agree din ba kayo? Also, kung na-notice din ninyo, we actually have 3 doors. Meron tayong 3 pintuan na pagpipilian papasok sa puso ni AKI and we have pre-renal, intrarenal, and post-renal. So first, let us talk about the pre-renal. So from the word itself, pre means before. It is a condition where there is a hypoperfusion of the kidney or the kidney function is impaired due to the reduced blood flow to the kidneys and not due to the damage within the kidneys themselves. It means yung problem natin ay hindi yung kidney kundi yung nasa labas ng kidney. So green door yung una nating papasukan kasi green flag pa dito si kidney dahil hindi siya sa kanya yung problema. So possible causes natin sa pre-renal ay intravascular volume depletion wherein there is a reduction or pagbaba ng blood volume na nasa blood vessels such as in the case of blood loss associated with trauma or surgery. We also have dehydration. Then decreased cardiac output as with cardiogenic shock, which is a life-threatening condition because the heart is not able to pump enough blood to support the body. We also have decreased peripheral vascular resistance, wherein there is a decreased organ perfusion or hindi na maganda yung blood flow that could result in organ damage or shock. We also have decreased renovascular blood flow, kung saan yung blood supply na papunta sa kidneys is reduced due to narrowing or blockage of the renal arteries. And then pre-renal infection or obstruction. Moving on, as the kidney problem advances from the outside, in intrarenal, it can be found inside, specifically in the parenchyma of the kidneys. There is already an actual damage to the kidney tissue. The parenchyma of the kidney is the functional tissue responsible for filtering blood and producing urine. It is divided into 2 parts, the cortex and the medulla. So possible problems natin dito ay tubular necrosis, wherein necrosis means death of the body tissue. There is already damage and death of the kidney's tubule cells and posibleng dahilan nito ay lack of blood flow and oxygen to the kidney tissues or ischemia. Prolonged renal ischemia, intrarenal infection or obstruction. Like for example, there is a presence of bacteria such as E. coli that typically enter the urinary tract through the urethra and then travel up to the kidneys. Nephrotoxicity that refers to the kidney damage or dysfunction caused by exposure to chemicals, drugs such as NSAIDs, antibiotics, especially mga non-prescribed meds and OTCs or other substances. And last but not the least, we have the post-renal, wherein there is an obstruction to the urine flow. Dito, hindi lang kidney yung may possible damage, kundi pati rin yung in between the kidney and the urethral meatus. There could be a bladder neck obstruction that occurs when the narrow opening at the base of the bladder is blocked, preventing urine from flowing freely into the urethra, and possibly dahil sa calcifications or stones. Bladder cancer, yung pinakamasakit sa lahat. And then, calculi, as what I have mentioned earlier, especially sa mga mahilig kumain ng maalat, and of course, ang paborito ng lahat, soft drinks and instant noodles. Then, we also have post-renal infection. And finally, ang most exciting part of all, we have here the pathophysiology of acute kidney injury. But before that, let me introduce myself first. I am Nurse Hope, your Manang RN on duty for today. Kakasimula ko pa lang gumawa ng mga lecture videos and I'm planning to do more. I hope you could learn something today and please continue to support my work. Kaya ari lang ako dire to help you understand and make your nursing journey bearable, achievable, and of course, kabogable. Anyways, tara! Let's get down to business. So, although the pathogenesis of AKI and oliguria is not always known, many times there is a specific underlying cause, and some of the factors can be reversible if ma-identify ng mas maaga o magamot agad bago tuluyang masira yung kidney function. Actually, there are a lot of precipitating factors that could lead to AKI. However, here are some of the most common factors, and this includes hypovolemia, hypotension, reduced cardiac output, and heart failure, obstruction of the kidney or lower urinary tract by tumor, blood clot, or minsan kidney stones, and bilateral obstruction of the renal arteries and veins. If these conditions are treated and corrected bago pa man masira yung kidney permanently, yung changes sa laboratories such as BUN and creatinine levels, oliguria, and other signs may be reversed. On the other hand, here are some of the predisposing factors that may put patients at risk of AKI, and this includes hereditary stone disease, also known as genetic stone disease, that can be passed down from families such as cystinuria, a rare genetic disorder that causes the kidneys to leak too much cysteine, an amino acid, into the urine. Cysteine does not dissolve easily and leading to the formation of cystine stones. Primary struvite stones, also known as infection stones, are kidney stones that form due to urinary tract infections caused by bacteria. Infection-related urolithiasis or formation of solid mineral deposits in the urinary tract, including the kidneys, ureters, bladder, and urethra. Anatomic and functional urinary tract anomalies and spinal cord injury may cause recurrent bouts of obstruction. So with the presence of both precipitating and predisposing factors comes the phases of AKI. So let us start with the onset or the initiation phase. It begins with the initial insult and ends when oliguria develops. Then we have the oliguric phase. It is accompanied by an increase in the serum concentration of substances usually excreted by the kidneys kagaya ng urea, creatinine, uric acid, organic acids, and the intracellular cations, which is the potassium and magnesium. So for some clients, oliguria does not occur and urine output is normal. Oliguria means there is a little or konti lang yung napapalabas na urine ng katawan. Otherwise, the duration of oliguria is 8 to 15 days. The longer the duration, the less chance of recovery. There is also a sudden decrease in urine output of less than 400 ml per day. And take note, the minimum amount of urine needed to be excreted from the body is 400 ml in 24 hours or 0.5 ml per kilogram per hour. So in this phase, uremic symptoms first appear and life-threatening conditions such as hyperkalemia may develop. So, signs and symptoms that may manifest in clients during oligoric phase are the following. First, we have excess fluid volume that includes hypertension, edema, dysrhythmia, heart failure, and pulmonary edema. And take note, restrict fluid intake if merong hypertension ang patient and make sure to monitor the intake and output of the patient. We also have uremia or the presence of urine in the blood can also manifest such as anorexia, nausea, vomiting, and pruritus or pangangati ng katawan. We also have metabolic acidosis that is presented by Kussmaul's respiration. And then signs of neurological changes such as tingling of extremities, pagkahilo na pwedeng mag-progress sa pagiging disoriented and then coma. We also have pericarditis such as friction rub, chest pain with inspiration, and low-grade fever. And laboratory changes such as increased BUN and creatinine, decreased urine-specific gravity, and GFR. So, isa sa mga management na pwede nating gawin as nurses is to administer medications such as diuretics like furosemide as prescribed to increase renal blood flow at maipalabas ang sobrang fluids and electrolytes na na-retain sa katawan. And after the oligoric phase comes the diuretic phase. So the diuresis period is marked by a gradual increase in urine output which signals that the glomerular filtration has started to recover. Urine output rises slowly followed by diuresis up to 4 to 5 liters per day and therefore there is already an increase in urine output. Excessive urine output indicates that the damaged nephrons are recovering from their ability to excrete waste. So signs and symptoms that may occur during this phase includes dehydration, hypovolemia, hypotension, and tachycardia. Level of consciousness may also improve, laboratory values stabilize, and eventually decrease. Patient must be observed closely for dehydration during this phase. If dehydration occurs, the uremic symptoms are likely to increase. So finally, the recovery phase or the convalescent period which signals the improvement of renal function. Recovery process is slow, complete recovery may take up to 1 to 2 years. And during this phase, urine volume returns to normal, memory improves, strength increases. The older adult is less likely than the younger adult to regain full kidney function, and laboratory values return to the patient's normal level. Take note that AKI can progress to chronic kidney disease or CKD. And the signs and symptoms of AKI are primarily caused by the retention ng nitrogenous waste, fluid retention, and the inability of the kidney na mag-regulate ng electrolytes. Again, we have the 3 phases of acute kidney injury, starting with the onset, then oligoric phase where the patient experiences decreased urination, followed by diuretic phase, and lastly the recovery phase. And the 3 possible causes of AKI, we have the prerenal, wherein the problem is outside the kidney. The intrarenal, wherein yung may damage ay nasa loob na ng kidney, specifically the parenchyma. And lastly, yung postrenal, kung saan yung may possible damage ay nasa gitna ng kidney and urethral meatus. And that wraps up our topic for today. Any questions, everyone? With that, I hope that you learned something today. And here are my references. Once again, this is my first time doing this lecture video and I am very much willing to welcome your feedbacks. Please support my work by subscribing in my YouTube channel at Nurse Hope and hitting the notification bell to keep you posted. Thank you for spending time with me. Once again, I am Nurse Hope, your Manang RN on duty for today. I am wishing you all the best, God bless, and see you soon. Bye-bye!